Yeah, hello. Hello everyone. I'm happy to present you some results on the impact of deep brain stimulation of the subthalamic nucleus on the functional organization of the prefrontal cortex in Parkinson's disease. And the motivation for this study were results that show that deep brain stimulation can have can induce changes in the metabolism of the prefrontal cortex. And what we know about what is thought that these changes in metabolism are associated with cognitive side effects that some of these patients are experiencing. And what we know about the functional organization of the prefrontal cortex is that it follows a rostral to caudal hierarchy. So it is assumed that activity in rostral areas precede and determine the activity in more caudal areas. So there should be some kind of information flow from rostral towards caudal areas within prefrontal cortex, and accordingly we should be able to predict the activity in caudal areas from the activity in more rostral areas. And this is exactly what we're trying to do. So we use functional near-infrared spectroscopy, which is an optical method to measure the changes in cortical oxygenation, so something similar than fMRI. And this method has some advantages over other imaging methods. So, for example, it provides a very high temporal resolution and also a good signal-to-noise ratio, and which makes it very well suited for the application of Granger causality. And we are here using a frequency domain implementation of Granger causality, and that is partial directed coherence, or PDC. And we use this directed connectivity measure to analyze differences in influences in rostral to caudal direction, which you can see here in the upper brain, in the top brain, and influences in the other direction, which you can see in the lower brain here. And what you can see here in healthy controls is that there is indeed stronger influences in rostral to caudal direction than in caudal to rostral direction. However, what you also see is that at this very rostral area in the prefrontal cortex, this directionality is actually reversed. So there are stronger influences from the midlateral region towards the rostralmost area of the prefrontal cortex. And this is also in line with very recent findings of this rostral-caudal hierarchy. And it's actually an important detail, and I will come back to that later also. Now, first, here's what we done. So we assessed 24 Parkinson's patients with deep brain stimulation of the subthalamic nucleus, and we identified 3 determining factors that impact on the functional organization of the prefrontal cortex, or on this rostral-caudal gradient. And the first one is the volume of activated tissue, so basically reflecting the stimulation strength. And the second was the amount of dopaminergic medication patients took. And in this talk, I will only focus on this third variable, that is the disease duration at the time patients underwent surgery. So we measured patients in 3 resting state conditions, first in steady state on stimulation, and then after stimulation was switched off for 2 hours in a steady state off stimulation, and in a third measurement immediately after we switched stimulation back on. And for statistical analysis, we selected these connections between neighboring channels along the rostral-caudal axis in both directions. And what we found is that on stimulation, there was a very strong correlation between the strength of the gradient and the disease duration before DBS surgery. So this correlation was negative. That means patients that received DBS early in the course of their disease showed a very strong rostral-caudal gradient, whereas when patients only received DBS after longer disease durations, these influences in rostral to caudal direction were severely attenuated. Now, when stimulation was switched off, this correlation was completely absent. That means there was no difference between patients that received stimulation early and patients that received stimulation after longer disease durations. However, when we switched stimulation back on, this correlation re-emerged immediately. That means, again, patients with a short disease duration at the time of surgery showed a very strong gradient, and patients with a longer disease duration showed again a very weak rostrocaudal gradient. So, taken together, this result shows that DBS indeed impacts on the functional organization of the prefrontal cortex. Now, to be able to conclude something about whether this is also relevant for behavioral and cognitive outcome, we also assessed patients on stimulation and a group of matched healthy controls with a cognitive task that is known to rely on the prefrontal cortex, and namely that is the Tower of London planning task. And to control for the overall group differences between planning performance between patients and controls, we mean-centered the planning performance for both groups separately. And what we found is that there was indeed a correlation between planning performance and the strength of the gradient. Now, as I told you before, the gradient is actually reversed in the rostralmost area. And this is also exactly the area where we found the correlation between performance and the gradient. So the better participants performed in the planning task, the stronger the gradient got. So in patients and healthy controls that performed better than the group mean in the planning task, there were very strong influences from mid-lateral region towards the rostralmost area. So, taken together, this result shows that we really measure some functional integrity of the prefrontal cortex with this approach. However, what this results also show is that spatial resolution is of interest here. And we addressed this issue in a cooperation with Nyrix Medical Technologies, and what came out of this cooperation was a new high-resolution near-infrared spectroscope, and it not only provides a higher spatial resolution and a higher temporal resolution, but also introduces depth resolution, so we can now correct the signal that we record for extracranial signal contributions. And hopefully this technology will improve estimation of network connectivity in the future. And I also brought some first data that we acquired with this new device, and we were here interested in the so-called stun effect. And the stun effect refers to the fact that the implantation of electrodes cause a small lesion in the subthalamic nucleus, and this effect closely mimics the effect of stimulation itself, but is regressive within a few weeks after implantation. So, so far we assessed 8 Parkinson's patients before and after DBS surgery, but before initial activation of the DBS system. And what you can see here is that the rostrocaudal organization in patients with a shorter and a longer disease duration, so in this case less than 10 years and more than 10 years, is actually quite similar before surgery. However, after surgery, we see that patients with the longer disease duration show a more severely attenuated rostrocaudal gradient than patients with a short disease duration. So this result is very well in line with the stimulation effect I showed you before, because it again shows that surgery attenuates the prefrontal gradients in patients with the longer disease duration. So I think our approach really is able to reflect the functional integrity of the prefrontal cortex, and these results demonstrate that it may be favorable for patients to undergo surgery earlier in the course of their disease. So I'm happy to take questions. Also, this afternoon at the poster reception, you can find me at poster number 1000, so the first poster at the very end of the hall. And thank you for your attention.
Thank you very much, Dr. Konrad. It's a very interesting study. And let us invite the questions or comments from the audience. Okay. This different modulating effect, the effect on the prefrontal cortex according to the disease duration, it is related with the general effect of DBS2, for example, the motor effect or like that.
If it's related to the
the
motor
general,
outcome?
Yeah, yes. Yeah, I mean the effect of the DBS itself for the motor function of the PD patients.
You mean whether patients with the longer and shorter disease duration have differential outcome in motor?
They have different prefrontal modulating effect, but how about on the general DBS effect?
So we patients underwent a UPDRS score, but we in this analysis we didn't focus so much on the motor outcome because we were interested in cognitive functions. But I think there was no much. Yeah, well, I mean, there's a lot of variance, of course, how well patients respond to DBS, but this was not related to how long they have been treated with DBS or how long they were they suffered from the disease at the time they underwent surgery.